Alright, one of the things we want to talk about today is preventing problems. And one of the problems that a lot of people don't realize that can be prevented is arthritis, specifically degenerative arthritis. So when you think about degenerative arthritis, osteoarthritis, what do most people think about? Old age. Well, I had a patient come in the other day. He said his hip was worn out. And I said, well, that's terrible. What's going on? And he said, oh, the doctor said I'm just old and it's worn out. And I thought for a second. I said, well, wait a second. How's your other hip? And he said, well, that hip's totally fine. And I said, well, wait, how old's that one? So if you think about it, why would one hip wear out because it's old and the other one's the same age and it's fine? Doesn't make any sense at all. In fact, if age was the reason why you had arthritis, then every joint in your body would be worn out exactly the same, and we just never see that. So there's something else going on in there. And what that is compressive forces from the muscles being damaged from things you do in life. So I'm going to show you some of the muscles along your joints. And here's a picture. If you look here for a second, you have all these little tiny muscles along your spine. And these little tiny muscles are called stabilizer muscles, and they actually hold your joints together. And what happens are when one of these small muscles gets injured, it will actually compress and then start to squeeze the joint. I'll show you. The joint works like this. You have a bone and you have another bone, and then in between the bones you have a substance called cartilage. And cartilage, just for demonstration purposes, we'll use this paper. It lines the bones, and what happens is you have those little muscles I just showed you crossing over the joint. When those muscles get hurt from something that you do, like a slip, a fall, a car accident, something like that, a sports injury, when those get hurt, the muscles will spasm and contract. When they contract down, what do you think is going to happen to the space in here? As the muscles contract, it squeezes together and then causes wear and tear on this cartilage excessively. And over time, it will cause all of that cartilage to wear out. Then this cartilage is gone. You have what's called bone on bone, and boy, that's a big problem. So, how do we prevent that? What's the cause of it? The cause was those tight muscles. And so by utilizing the chiropractic care we provide, specifically with the ProAdjuster technique or the computerized adjustments, we can stimulate the deep muscle to relax, which then opens up the joint and then makes that cartilage last longer. That's the idea behind all of that works. So if you think about it, who do you think should be doing that? Pretty much anybody who wants to keep their body functioning well and try to do all they can to prevent future problems.